We're going to go ahead and get started. Welcome to the Oishi Symposium. I'm very excited to see such a well-attended meeting. This is incredible. We had 299 registrations, which to my knowledge is the largest we've ever had for the Oishi Symposium, and we've also had a lot of drop-ins. So welcome. We are very excited to have you. Hope you learned some great things today. Just a couple of housekeeping items regarding your SOCRA continuing education and nursing continuing education. We did our best to give everyone an evaluation as you were coming in. If we missed you, please pick an evaluation up during the break. It is important that we get those evaluations to better improve your experience in upcoming group meetings. The SOCRA certificates are pretty self-explanatory. You'll just write your name on it when you receive it. Nursing certificates are a little bit different this year. Unfortunately, the Oncology Nursing Society no longer provides continuing education, so this year we're using the Kansas State Board of Nursing. When you get your certificate, it is imperative to write your name and your license number on it. If you don't know your license number, write it as soon as you get home. If you have to turn these in for auditing or anything, it must have that license number on it, okay? So that's just for the nursing certificates, and we have different colored ones, so you'll be able to tell the difference when we're picking them up at the end of the symposium. Let me think. I think that's pretty much the main things for housekeeping. I did forget to introduce myself. My name is Maggie Ward. I am the co-chair of the Education Subcommittee, so I help put together the Oishi Symposium. I work with some of the different protocol groups and putting together online webinars, and then just organizing various aspects of education for nurses and CRAs, anyone part of the ORP or Oncology Research Professionals. If you are interested in education or if you have ideas for how we can better educate our ORPs, please don't hesitate to stop me, don't hesitate to let me know, put it on the evaluation, anything like that. I'll be around throughout the meeting. I would also like to give a special thanks to Crystal Cowart and Kristen Lewis, who did an amazing job helping me put this together this year. And they are out front right now, but I'm very appreciative of those two. I'm going to invite Seal Petrowski up, who is the chair of our Disease Liaison Committee, and she's going to discuss some of the openings we currently have in the ORP committee, and then we will get going with your day. Thank you so much.
Thanks, Maggie. So the ORP Liaison Committee have nurses and CRAs that actually work on specific disease committees, reviewing protocols during development and giving feedback in the development phase as it affects the feasibility of operating studies at your sites. So we have several openings, and I'm just going to list them out. If you are interested in any of these, please come see me. I'll be at Round Table this afternoon, and I can certainly go into a lot more detail about those specific roles within those disease committees. So we currently have two openings in the breast committee, a nurse and a CRA position. One of our senior RN liaisons retired this year, Kathy Saplicki. We also have an opening in the cancer care and prevention, a RN position, cancer symptom control for quality of life, one CRA. If you're interested in digital engagement and social media and would like to get involved in that committee, we have an opening for a nurse or a CRA, so please let me know if that's something you're interested in. The Early Therapeutics Committee is really active with the DART study, so they are really looking for someone to join that committee and represent the sites. So they're looking for a nurse. GU Committee, the subcommittee of prostate is looking for a nurse, and then the GU Bladder Subcommittee is looking for a CRA, and then we have two openings for the Leukemia Committee. The other thing I wanted to point out is last year I did a presentation on a project that the ORP Liaison Committee worked on for about 2 years with the Protocol Coordinator Office, Dana Sparks, who's been very supportive, and we did a clinical trial review guide. So there's a survey project around that looking at the effectiveness and the impact of this tool at sites. So the email went out this week. You should have gotten an email from the Protocols Operations Office, and it's basically, if you complete this survey, it's about a few minutes, just asking what your education, some descriptions about your site, if you've reviewed a protocol in the last 2 months but not yet implemented, and your comfort as far as being able to implement it in your knowledge about the study, complete that survey, and then the clinical trial review guide will be sent to you, and we're asking you to review that same protocol using the guide and then answering questions after that. So I'll also be at roundtable going over that project as well. So thank you very much.